Everyone who is joining us online can hear me. We're going to get started. A few people still coming into the room, but I do want to keep us on time. So just want to say hello and welcome to the UCLA Center for Health Policy Research. My name is Gwen Driscoll. I am the Director of Communications here, and it's my pleasure to welcome you to our 2016 Health Policy Seminar Series. Okay, before we begin, some housekeeping as always. We are going to, I want you all to save the date of Monday, February 29th for an exciting and first ever seminar on the Elder Index, which is a cutting edge poverty measure that takes into account the true cost of living in all 58 California counties. The center has published several years of data on the Elder Index. But in this seminar, Dr. Stephen Wallace, the center's associate director and a professor in the UCLA Fielding School of Public Health, will discuss how living above or below the Elder Index has direct impacts on health and access to health care. He will also give a brief history of the Elder Index leading up to the passage of California's Elder Economic Planning Act of 2011. And he will describe how conventional poverty measures such as the federal poverty level really limit legislators from accurately understanding the problems facing their constituents. Again, that's February 29th at noon. Okay, as for today's seminar, we will be recording it and it will be placed on our website at the address you see right in the middle here. If you'd like copies of today's slides emailed to you, please email me at gdriscoll@ucla.edu. You can see it there on the slide. If you want news of our upcoming seminars and events at the center, we always have something exciting going on. Please, I encourage you to subscribe to our e-newsletter, our once-a-month e-newsletter, Health Policy News, and that's the address at top. And please note, this is an old slide, but please note that we will be having a brief question and answer period at the end of today's seminar that I will moderate, and that includes our online participants. Okay, without further ado, I'm now happy to introduce today's presenter, Dr. Matt Jans. Matt is the Data Quality and Survey Methodology Manager for the California Health Interview Survey. As such, he is both the chief guardian of CHIS's data quality and the lead developer of new and innovative ways to collect data on diverse, often hard-to-reach populations. One of the hardest to reach has been transgender Americans, in part because this group continues to face widespread discrimination, but also because sexual identity can be a fluid definition, especially for those who do not conform unambiguously to conventional notions of male or female. Although CHIS has surveyed lesbian, gay, and bisexual Californians for years, really since the first CHIS, right? It has only very recently, in close collaboration with UCLA's Williams Institute, come up with a methodology that can accurately and sensitively identify transgender people. The implications of CHIS's work can now be felt nationally, including in an Office of Management and Budget work group on LGBT data collection that will inform federal health surveys. More importantly, it may finally shed light on and lead to better health outcomes for a long marginalized population. Matt received his PhD from the prestigious program in survey methodology at the University of Michigan, and he's worked at the U.S. Census Bureau before coming to CHIS. He has been designing and assessing surveys for over 15 years. So please welcome Dr. Matt Jans.
Thanks, Gwen, and thanks to everybody who came out today. It's a pleasure to present this research, and it's great to see all the faces in the audience and the 100 or so online. So just this morning, as I was looking at my slides one more time and checking email, I noticed that the Williams Institute put out a report today that said that at least 2/3 of people in all the states in the U.S., all 50 states, support the right of transgender people in employment situations. So I thought that was really neat to hear. It would only be so great if our health statistics on transgendered people were just as good and as broad across the whole country. I'm going to talk about that gap and how we're trying to fill it today. And by the way, in California, that was 86% of the population supporting transgendered rights in employment. We've mentioned the Williams Institute a couple of times, and I should say, and I'll probably say again, that they were very close collaborators on this. This was truly a joint project. If you know the public health landscape for transgender health, you know that there are some statistics out there. There aren't a lot. The research that's out there suggests that transgendered individuals have a higher HIV prevalence, higher rates of sexual victimization and assaults, higher rates of self-harm and suicidality, and also just barriers to getting healthcare in general. And you can imagine that if you're a transgender person and whether or not you've transitioned to the other gender or not, finding a reliable health care provider who you can trust, who knows your situation, who knows how to work with transgender patients can be pretty difficult. The big problem for us as a general population health survey is that there just aren't a lot of general population statistics on this population. A lot of the surveys and studies that are done are special samples. They're not the large-scale surveys with representative samples of the general population that you would like to know more about the population and set sound policy. So that takes us to the survey methodology landscape for transgendered persons. A lot of surveys don't ask this, and we wondered why. If you're a transgender person, you just don't get a chance to say that you are transgendered in most surveys, and that leads to a lack of statistics on the population. And speaking as a survey methodologist, I think we as a profession are somewhat to blame for this. It's a complex topic. There's lots of different terminology that's used to talk about gender and gender identity and transgender status. There's no universal terminology. In fact, the term transgender doesn't work for everyone. So when we see areas like that, it becomes hard to write a good survey question that everybody can understand and answer equally. You see phrases out there like pangender, bigender, gender fluid, gender queer, or the term cisgender, meaning non-transgender, so people who have a biological, anatomical sex that matches their gender identity. So if you work in this field, or if you're transgender yourself, you have transgender friends, you know that there's a lot of different ways to identify yourself. And on top of this, this gets into just sexuality topics in general, which can be difficult to survey about. It can either be a slippery slope into just using the wrong term in a survey question that becomes offensive, so people won't answer. Sometimes survey designers worry that more conservative people who are in the sample will find the questions too personal and won't want to answer. And sometimes survey designers will actually confuse terms and concepts like sex, gender, transgender, sexual orientation. I'll talk about all of this. Methodologists in general have wondered, are the relevant constructs really so difficult to identify and measure? Well, if you think about it for a little bit, if you ask people, if you read the literature, you can pretty quickly come to the conclusion that sex, gender, sexual orientation are all very different things. And once you break them out, it becomes easier to ask survey questions about them. Sex is the physiology, the morphology, the parts you have, so to speak, the anatomy. Gender is more about feelings and perceptions. And sexual orientation is something different. That's about who you're attracted to. So we're going to set that aside as a different construct. But sex and gender are pretty closely tied. And in fact, in most statistical reports and surveys, you'll see a sex question, one that asks whether you're male or female, listed as a gender question, right? So we've confused the terms in our heads a little bit already. So if we sort them out into two separate constructs, it becomes much easier to think about scientifically. How could we do this in surveys? Well, we could ask respondents to identify with a definition of transgender. That is, we could say, to be transgender means this, are you transgender? Or we could ask, what sex were you born? And how do you identify now? I'll talk about both of those versions. The big questions for methodologists across all surveys, all fields, not just health surveys, not just public health, is it possible to accurately measure gender identity in a general population survey, where you have transgender people, non-transgender people, people from all walks of life? Or is it just too fluid and squishy, for lack of a better word, concept that you can't put it into a simple one or two survey questions? The second question is more statistical, and it has to do with how many people in the population are transgender. I'll show you some statistics in a moment. It's a very small proportion, and so we always wonder that even if we identify transgender people accurately, we get the definition right, will there be enough people in a sample to be useful statistically? I'll talk mostly about the first question, but I will talk about both. The first question really gets down to measurement issues and methodology. We know in survey questions of any type, when we use complex academic terms, we confuse respondents. So we always try to bring survey questions down to a level that even the least educated of people in the sample could understand. So even the word transgender might be too much to use. In addition, I mentioned this a little bit, the self-selected gender labels that people who are transgender use can vary quite widely. And there are probably terms out there that haven't been discovered, so to speak, because those people haven't been surveyed before. But even on a conceptual level, we want to think about what it means to be transgender. That's usually where we start. It's certainly on a continuum. Are we talking about something like a man who likes to knit, because that's sort of a stereotypically female or feminine behavior or activity, or a woman who works on cars, things that are more feminine or masculine being engaged in by the people of the other sex? We'd say no, that's not really a transgender issue. That's more a gender expression issue, perhaps, and I'll talk about that very briefly toward the end. Further along the continuum of gender and gender identity, you could think of people who are born as one sex, for example, born male, and now live or feel like they're a woman, male to female, or vice versa. And on the far end of the continuum, people who have fully transitioned. They now have gone through a sex reassignment, realignment surgery, and actually live as the other sex than what they were born. We're really going to focus on the bolded definition sort of in the middle there, but I'll talk about the range. The statistical methodological issues, the sample size issues, are important too, of course. It's a very small portion of the population, so even a few false positives, if we get that definition wrong, and some people who aren't transgenders say they are, or if the interviewer enters the wrong code, for example, that can really throw off the proportion because the overall count is going to be so small. So we need to make sure that that measurement is precise. The other issue is that because it's such a small portion of the population as a whole, we have to sample so many more households and people to get a few transgender people, to get enough to do statistical analyses that have enough power. So with a recurring survey like CHIS, you may end up having to combine several years of data, for example. And anybody who works with small populations knows this as a real challenge. So a very brief timeline on transgender and gender identity measurement. Just from my own quick review of the literature here, this is a little bit offset, it looks like, but in 1965, the term was first used in scientific and medical literature. Just to say that it's not a brand new concept. It's been around for a while. Obviously, people being transgender has been around probably for the eternity of time, but even in the scientific and medical literature, the term transgender itself has been around. Those earlier definitions still had medicalized, pathologized, sort of stereotyped terminology, more of a negative terminology than what we use today. The first official statistical measurement of transgender I could find was in 2000 from the Vermont Birthis. If we have time at the end, I'll talk about the wording of that question a little bit. The one that we talk about the most and we use as a benchmark and the source of one of the questions we tested came in 2007, the Massachusetts Birthis, where they found that about half a percent of the population in Massachusetts, age 18 to 64, identified as transgender. By the way, all of the highlighted links you have here, if they're not in the PDF, in the version that you can get, I have hyperlinks to the articles. In 2011, the first national estimate of the transgender population came from Gary Gates at the Williams Institute, finding that about 0.3% of the population is transgendered. And then in 2014, the work I'll be talking about today, the Williams Institute published their Genius report for best practices in transgender measurement, and our pilot test flowed directly from that. There are some other estimates out there, and it's interesting here to note the range that those estimates can take. So in this first paper, between 0.5% and 2% of the population have strong feelings of being transgender. That's a pretty wide range. If you extrapolate that to the number of people in the U.S. or California, that's going to be a pretty wide range as well. Those same authors broke this down into people who actually took steps toward transitioning and found that between 0.1% and 0.5% actually took steps. But still, these are wide ranges, and it just gives you a hint of how difficult it can be to define these concepts and get a solid measure. Internationally, in the UK, about 0.1% of adults are transgender, again being defined as people who have taken some transition, some actions toward transition to the other gender. So our question wording pilot test, let me talk about that for a moment. I'm the survey methodologist, have been for a while now. When we wonder things like this, can we measure how many people will we get? We do research, so that's what we did in this case. We wondered pretty specifically what terminology would be sufficient and clear to ask of all respondents. Will transgender respondents have the adequate response options to identify themselves, all those different terms that may be used by one or two people? And will non-transgender or cisgender respondents be able to answer accurately too? So we don't want to use terms that are too confusing as well. We did worry, and this is a worry that a lot of survey methodologists and survey funders and designers have had, well, will the terminology offend? And that's a two-sided coin. Inaccurate terminology could offend the transgendered folks who we want to identify. We don't want to use the wrong terms and turn people off. On the other hand, we worry that this question might be so sensitive that merely asking it of the whole population is going to turn people off. And the big concerns for survey data are they won't answer the question, they'll say don't know or refuse, or they'll just hang up the phone, or they'll shut the door. I'll give you evidence in a minute that doesn't happen, by the way. So our design goal pretty clearly was to find question language that could be clearly and consistently understood by all respondents, whether they're transgendered or not, whether they've heard the term before or not, whether they're living under a rock or in a house or whatever. And that's what we aim to do. If you read that Genius report from the Williams Institute, you'll see at least a couple of ways of asking this. The first is to ask a single question. Tell the respondent what, for your survey, it means to be transgender, and then ask if they're transgender. We call that our one-step version because it asks it in one step. The second way, and the second way is the recommended best practice from the Genius report, is to first ask the sex that the person was born or assigned or identified as at birth, and what gender they identify with now. We call that the two-step version because you have two survey questions. We tested two versions of each of these. So we tested two one-step versions and two two-step versions. Now I'm going to take a minute on this slide and read these out loud to you because I think it's important to understand our findings. These were read in a phone survey, so they were read out loud to respondents. Respondents had to listen to them and then answer. So to get a sense of how this would have sounded, imagine that you're on the phone doing CHIS as a respondent. I hope you all would if we called you. This is what this question would have sounded like. The first one-step version read, some people describe themselves as transgender when they experience a different gender identity from their sex at birth. For example, a person born into a male body but who feels female or lives as a woman. Do you consider yourself to be transgender? The second one-step version read like this. Sex is what a person is born. Gender is how a person feels. When a person's sex and gender do not match, they might think of themselves as transgender. Are you transgender? So you can already see that there's a little bit of a difference here. The second one's a little bit shorter. The first one has a more concrete definition with an example. For example, a person born into a male body who feels or lives as a woman. So the respondent can actually picture that and say, oh, I know what that means. The second one's a little bit more vague about what that means for sex and gender not to match. Those were the two one-step versions. The two two-step versions were very similar to each other with the addition of a phrase in the second question. So let me read the first one-step version to you. First question, what sex were you assigned at birth on your original birth certificate? Second question, do you currently describe yourself as male, female, or transgender? Now, surprisingly, not many people say they don't know to the first one. I kind of, in the back of my head, thought people are going to say, well, I was just born. I don't know what they actually put on the form on my original birth certificate, but that doesn't really happen. People answer, sometimes they sound quizzical and say, well, male, I guess, and I've never seen my birth certificate, but that's what should be on there. That question doesn't seem to pose a problem for anybody, and the second one doesn't either, and I'll show you some statistics on that. But you can see two very quick, short questions to get at the same concept. The two-step version 2 has this first lead-in question, and I'll read the whole thing just so you get a feel for it. What sex were you assigned at birth on your original birth certificate? The second question reads like this. Do you currently describe yourself as male, female, transgender? Are you not sure yet, or do you not know what this question means? That second new ending phrase on the second two-step version was added because this was originally done in a survey of youth. And so the idea was that, well, they might not know the terms yet. They might still be wondering about their own gender identity, and might not be sure. So they were given that option to explicitly provide that response. Those were two-step gender identity questions. The pilot sample itself was in the California Health Interview Survey, CHIS. If you don't know, we're a random digit dial phone survey of the household or non-institutionalized population of California. We're cross-sectional. We interview about 40,000 people every 2 years since 2001. You can see more about our methodology at the link there. And we have a history of asking sexuality questions since our inception, as Gwen mentioned. We've asked sexual orientation and sex of sex partners every cycle of CHIS. We've asked same-sex marriage and registered domestic partnerships. And in addition to some of those more social demographic questions, we've also asked sort of your typical sex-related health questions like HIV status, testing, and other sexually transmitted diseases. We also have a pretty rich history, and we're proud of it, of including hard-to-survey populations, including racial and ethnic minorities, which are formally designed into our sampling and oversampling processes, linguistic minorities as well. We interview in Spanish, Cantonese, Mandarin, Vietnamese, Korean, and Tagalog, which a lot of surveys don't go beyond Spanish and maybe Chinese, depending on the state. And we have questions that get at immigration status and generational status. So again, not just surveying, but asking the questions to do the analyses on populations like this. And of course, we ask whether people are insured, employed, things like that. And then from the methodological standpoint, we've also in the past few cycles surveyed cell phone only households. So these are households who don't have a landline anymore. They have only a cell phone, and to get a representative sample of any population nowadays in a phone survey, you have to do that. So they are considered, but they are harder to reach. They cost a little bit more money, and they're considered a hard to reach population as well. The experiment ran in the fall and winter of 2014 in production CHIS data collection. So this wasn't a special experiment in a lab. This was real survey respondents, real interviewers on the phone doing real interviews. In the interview itself, it followed the sexual orientation questions in the middle of the interview. We interviewed respondents only age 18 to 70 just for the reason that that's the same age range that we asked the sexual orientation questions of. And we obtained 2,828 responses to the 4 questions. So the outcomes I'm going to show you next are the transgender gender nonconforming rate, of course, that's the big one. The item non-response rate, so these are the people who said don't know or refuse to answer. We usually take those as indicators of difficulty or being offended by the question. I'll talk about breakoffs or hang-ups. Those are people who just stop doing the interview altogether. Again, an indicator of being offended by the question. And then I'll also talk really briefly about paralinguistics, behavior, and the duration of asking the question. So in other types of survey questions, we often find that when people do things with their voice when they're answering, so if they pause for more than a second or two, or they ask for clarification, or they kind of go as they're thinking of their answer, that means they're having a hard time answering, and sometimes they provide the wrong answer. So we looked for that. And then we just looked at how long it took to ask and answer the question as a sign of respondent burden and how much impact it would have on the survey as a whole. Okay, so with our results, I'll show you on some questions we have to wonder no more. We got some pretty nice and clear results on this. These rates are unweighted, but the overall rate that we found of transgender people from people who were asked the question was 0.3%. So that looks pretty close to what I showed you earlier, some other weighted national and state rates. That means that we identified 9 people as transgender. So again, this is a small sample problem, like I mentioned already. And if you look at the row below the circled row, so the not ascertained row, those are those don't know and refused responses, 1.3% of those asked. Now really that 1.3% is not that high as far as survey questions go. That's about normal for a non-sensitive, not difficult survey question, but we'd like to see it be a little bit lower, and it does vary pretty widely by the version of the question that we asked, so I'll show you that in a minute. This is the main plot that I think you want to look at for take-home messages here. Each of the versions of the questionnaire is a group of 2 bars there. The lighter bar on the left is the transgender identified rate that we obtained with that version of the question. And the darker bar is the one on the right is the rate of item non-response, the not ascertained. Again, these are unweighted, so they're not, official population estimates, but those will come with time when we have more cases. And the first thing you'll notice is that across all the lighter bars, we got about the same transgender identification rate in all of the questions, except for the two-step version 2, which is a little bit higher at 0.4%. Probably not statistically significant at that sample size, but it's just interesting that all the versions got very similar identification rates. The big take-home message here was that the way we asked the question made a huge difference in the not ascertained rate, the don't knows and the refusals, at a whopping, well, not whopping as far as all survey questions go, but compared to the average, 2.3% for the one-step version 2. Now, if you remember, I don't expect you to, so I'll tell you, that was the one that said sex is what a person is born, gender is how a person feels. It didn't have a really clear example of what a transgender person is, like the first one did, where it said a person who is born male but lives as a woman. And so my take-home message there is that not having that clear definition made it harder to answer. Then looking over the two-step version 2, that's the one where we first asked the gender, the sex assigned at birth and their gender identity now, but also gave them that out to say, I don't know what this means, or I'm not sure yet. And usually when you do that in survey questions, you see an increased item non-response rate. So that's what we're seeing there with that 1.7%. So you might look at what's left, the one-step version 1 and the two-step version 1, and say, well, why didn't you pick the one-step version 1? Because that has a really low item non-response rate and gets the same transgender identification rate as the one that you're saying there with your circle that you selected for 2015 and 16. That's what I'm going to talk about next. Almost next. Breakoffs. So one of the big concerns that anytime you talk about this in a survey design meeting, hopefully for not much longer, well, it's too offensive, it's too personal. People are going to not understand, they're going to not answer the question, which we saw doesn't happen if you ask it right. And on top of that, they're going to hang up, and they're never going to do our survey. They're going to quit that one, never going to do our survey again. We saw no breakoffs. We saw no hang-ups during or immediately after the gender identity items. So that's a non-finding. That's sort of a huge finding for asking these questions and administering these in surveys broadly. Now, so as for these paralinguistic behaviors and the question duration, this is where we get to the decision between choosing the one-step version 1 and the two-step version 1. We didn't really hear any paralinguistic behavior like ums and uhs or excessive requests for clarification or long pauses. So we stopped recording that data pretty quickly. And by the way, this comes from some extra monitoring that we did. I don't think I mentioned this explicitly, but as the interviews were happening, we listened in on some of them so we could hear how they were actually occurring. And for some of these, we actually recorded what was happening. Whether the person ummed or uhed or asked for clarification. And we didn't see any of that right away, but we continued to record the duration because we needed to know at least how long would adding this question take, or how much of the question duration would add to the overall duration of the interview that we had already. So we got these 4 versions to choose from, and we want to take the one that's the quickest and easiest as long as it gets the right trans-identified rate. So that's what I'm going to show you next. So the 4 versions here go like this. The one-step versions are the top row, one-step version 1 and 2. And then the two-step versions are on the bottom. And again, I've circled the one that we chose, the two-step version 1. And what these box plots show you is the question duration for English interviews that we coded. So this is, again, not the response time, but the whole reading of the question and the time it took for the respondent to answer. So it's a measure of the overall burden to both of the parties, the interviewer and the respondent, and to the survey as a whole. And you can see pretty clearly that the one-step version, or two-step version 1, just had a much lower average duration and a much restricted range compared to the other ones. So it was just quicker and easier to ask that question, and that was borne out by listening to these. So I hate to say things that you have to take on faith, but hearing was believing. I wish I could show you somehow just how easy this was for interviewers to administer and for respondents to ask, and the best I could think of was this plot. So by the way, that we tested this in English and Spanish. only, and it took a little bit longer in Spanish, about 2 to 6 seconds, but that same pattern of in the order of durations and with the two-step version 1 being the shortest was the same in Spanish. So that was an interesting finding as well. We did start to worry that older respondents might have a harder time, that it might take a little bit longer at least, just from the interactions that we heard and what we know about cognitive aging and hearing difficulties in a phone survey. But when we looked at duration by age, there was absolutely no correlation of the two. So that doesn't seem to be a problem at all either. So in the summary, I'll go over the clear conclusions again. And of course, anytime we do research, we have some more questions. We need to figure out how to get these into surveys as a whole, so our little test doesn't answer all the questions. The first big takeaway is that asking gender identity questions is not risky to surveys. And I hate to say that as a negative, because of course it enhances your survey, but it's still a concern of a lot of survey designers out there that it's going to cause problems, and it just doesn't. It's not confusing. The terms aren't confusing for the vast majority of respondents, and maybe even less so than sexual orientation questions, which we've been asking forever. It's not politically controversial on average, and what's interesting is there's no large negative effects when it is. So when we were monitoring these interviews, I even recall one woman very vividly who went on a little bit of a tirade about how we're part of a liberal agenda and Obamacare this and that, and even she was still answering the questions as she was giving us the tirade about how liberal our survey was. So I'm not concerned. Yes, she was multitasking, that's right. And so, you know, people will be mad, people will say, oh, I'm not sure, and if they want to, they might refuse, but they still answer, and they definitely don't drop off of the survey as a whole. No obvious negative effects on data quality overall, in other words, and it makes your survey more representative of an important population, so it's a win-win. But why did it work? I think I've said this, but to be really clear, we think that 2 short, quick, clear questions are better than 1 long, confusing one. And that's a good sort of take-home rule of thumb for survey design. You know, the 2-step version uses constructs respondents already know. The sex you were born with on your birth certificate, gender now. Maybe it's a little confusing for some, and they might be a little bit confused about why we're asking it. They seem to answer it just fine. And there's sort of a neat side point here with that version. It doesn't show up in the rates in that we don't get a higher transgender rate with that question, but what I like about it is that it allows a person to respond as transgender, in quotes, because they have a different sex at birth and identity now, without using the term transgender. So if you're a transgender person who uses one of these other phrases and just doesn't like that term transgender, you can still be captured in that construct in the survey without having to say that. So you can imagine a person who's fully transitioned from male to female or female to male might just say, I'm male, I'm what I live now. And this question captures that. Whereas one that says this and that, and are you transgender, they might say, I'm not transgender, I'm male, right? So I think that's a nice benefit of the question as well, just from respecting respondents. The big takeaway, part 2, that several methods obtained similar identification rates. That was kind of neat to see. But there were large differences in item non-response rates and question durations. So in terms of the overall data quality, there were some clearly better options than others. And we went with the one that was asking sex at birth and then current gender, which luckily is also the best practice recommended by the Williams Institute. Just to put our rate side by side with others, there's not a lot to say here, but it's maybe something you look at and think about after the fact. Just our unweighted rate there is circled on the left, and you can see the other rates that I talked about earlier in the slides. And you know, there's one big outlier there, and I really need to look at that study more closely to see exactly what the sample was and how they measured transgender. But in terms of the other ones, we're sort of right in the range there. Okay, so moving forward, that was just 2014. Now we're in just 2015-16. We're in it right now in the field. And we've gone forward with that 2-step version 1 question. We did wonder a little bit about asking about the original birth certificate. Not so much the birth certificate phrase, but 2 things. One, that having it at the end of the question may have had it, may have made respondents miss it, and the other part is adding the male and female response options into the question itself, so they know how they're supposed to answer. So the original one you've heard before, read was what sex were you assigned at birth on your original birth certificate, and we are testing a version that says on your original birth certificate was your sex assigned as male or female. So a little bit clearer and easier to answer. We haven't had a chance to look at the results yet to see if it's making a difference. In addition, early on I talked about the need to capture this construct very accurately so that we don't have people misidentifying themselves because they don't know the terms, or even interviewers accidentally miskeying the wrong response. So what we're doing now is if a person says they were male or female at birth and then something else, a different gender or a self-identified gender identity, we say, just to confirm, you were assigned male or female, whatever they said, at birth, and now describe yourself as male or female, whatever the other one was. Is that correct? So we get a verification check in there just as a sort of like early data cleaning step to avoid any coding errors. Also in the implementation, we're interviewing in all CHIS languages. So the pilot was in English and Spanish. Now we're interviewing in English, Spanish, Chinese, Korean, Vietnamese, and Tagalog. So again, trying to be more representative of the population. We're asking the older adults, those 71 plus, who weren't asked in the pilot. And the fresh off the press raw numbers, so completely unofficial at this point, are that in 2015 we saw 25 transgender or gender nonconforming respondents, which of those asked is about 0.26%. So we're still right around that 0.3% or so rate that we got in the pilot. Gender expression, I mentioned early on when we were talking about the continuum of gender identity, from a person who is a man and likes to do more feminine things or act in a feminine way, to a woman who likes to do more masculine, quote-unquote, masculine hobbies or acts in a masculine way. Okay, that was gender expression. Well, we decided to ask that of teens, and the idea was that teens might not have a solid gender identity yet. They might still be questioning it themselves. They might not know all the terminology, but they probably have a sense of how people perceive them. So of teens 12 to 17, we're asking a question that reads like this. A person's appearance, style, dress, or the way that they walk or talk may affect how people describe them. How do you think other people at school would describe you? Very feminine, mostly feminine, equally feminine and masculine, mostly masculine, or very masculine. And I don't have any results on this to show you yet, but that will be coming out when data and estimates are released for CHIS, so keep your eyes open for that. Beyond CHIS 2015-16, this really has us rethinking sex and gender in surveys generally, just CHIS and also federal surveys and other kinds of surveys. The big challenge now is how to think about handling sex and gender-based skips. So for example, if you have somebody who was born male and is now living as female and is fully transitioned so they no longer have a prostate, do you ask them questions about prostate cancer even though they were born a male? Or you could think of the same questions for breast cancer for somebody born a woman. And usually what we do with questions like that in a survey is we have an intro to cue the respondent that these questions are just for them because of their sex, and we might say these next questions are about men's health. That doesn't work anymore if you're including transgender folks in here in a just way. So a new lead-in might be something like, these next questions may be relevant to you because you were assigned male at birth. If not, let me know and I will skip them. Alternatively, if you had more questionnaire space to ask about how transitioned are you living as a woman, and have you gone through any sex realignment surgery, you could get down to the people who you should be asking certain questions of, but with just the 2 questions we ask, you would need some out like that. Now, the only caveat here is that not all sex and gender things are about your anatomy, and some are about your perceived gender. So if the question is about discrimination at work because you're a woman, for example, then we would probably want to screen people through based on their current gender that they live. So if they're living as a woman, it's more important to ask those questions than if they were born a woman. That's one way to think about it anyway. Beyond CHIS, like we've already mentioned a little bit, there's a lot going on at the federal level on this topic. The Office of Management and Budget has a working group on SOCI, sexual orientation and gender identity measures. I think we all know OMB a little bit, at least in the context of race questions. So this is the office that sets statistical policy for the U.S. So when people talk about what's the official census race questions, those come from an OMB standard on measuring race. So at some point we'll probably have an OMB standard on measuring gender identity that will have questions, hopefully like the ones we tested here. Of course, the aside is that there are other ways to measure gender identity and expression, and we were focusing on a simple way that could get an easy measure that would work in a general population survey. If you're doing a survey that focuses on gender identity or transgender populations specifically, so you're only recruiting people who are transgender or might be transgender, and you have a questionnaire that's all about sexuality and gender identity, you could probably use more detailed questions where you ask about transition status and unique terms that they use and things like that. You can see work by Joanne Keatley and others at the UCSF Center for Excellence in Transgender Health, as well as the Williams Institute, for questions that might work better in a survey like that. But that's all I have to share for today, so I guess we can do the question and answer. Thanks for your time.
Thank you, Matt. So we have a lot of questions from online, and I'm sure a lot in the room. So what I'm going to do is I'm going to take one from the room, one from online, and so forth. If we can't get to all your questions, please email me or Matt directly, and we'll make sure someone follows up. But from the room, Ying.
So the sex question will still count?
Yes.
Can you
So
repeat the question?
yeah, I will. Thanks, Gwen. So the question was whether we still kept the original sex question, or gender question, as we might call it. Are you male or female? Yes, that was when we did the pilot, and with what we're doing now, that's still in there. So we actually have that measure. And then when we ask about gender identity, our two-step version, we say, what were you born, what you were assigned at birth, and what do you identify as now? So, yeah.
So for your pilot test, do you find the discrepancy of the two?
I haven't looked at it yet, so I don't, Dave or Royce, do you remember if you've looked at that? Yeah, haven't. It would be interesting, right, if in a different point in the survey somebody says something different than what they said early in the survey. That's the way it works in SHIS anyway. Your gender, what's your gender, are you male or female? The basic question is early in the survey, and then gender identity, what was on your original birth certificate, is toward the middle. So it would be interesting if that was different, but I haven't looked at that yet. That's a good point.
Okay, an online question. It was in regards to one of your earlier slides. Can you comment on the health status of that 0.3% you were talking about?
No. I haven't done anything. Yeah. Oh, sorry. The question being, can I comment on the health status? No, we've only looked at the identification rates. We haven't looked at any health status by these rates yet. So timing of the analyses is one. The other is the sample size. So in our pilot, we had 9 people. That doesn't give you much data to work with. And even now, for 1 year of full CHIS data, we only have 25. So at the end of the year, we might have 50 and maybe more. Actually, that wasn't a full year, so we'll have more than 50 probably. But not a lot. So it might take 2 years to get some good statistics.
Someone from the room?
Not even. Oh, either one.
That's okay. So I was wondering, in that slide where you were comparing the non-response rate to different versions,
Yes.
your second highest non-response was for the one that you selected, I think.
Yes, that's right.
And do you have any information, well, sorry, it's your third one, but is there any information on who are the people that are uncertain and any indication of why?
A little bit. Let's see. So if you break out that overall item non-response rate into refused and don't know. So, yeah, sorry. To repeat the question, is there any information about the 0.3%, the 2.3%, the 0.7%, the 1.7% that are not ascertained? And there is, because in SHIS, we record whether they said don't know or whether they refused or something else. And survey methodologists usually think of refused as an indicator of being offended by the question or thinking it's too personal, and don't know is meaning that you either don't have an opinion or you don't know what it means. And so overall, it's split about equally. Actually, if I look here, the first version, the one-step version 1, had no don't knows. It was just 2 refusals in that one. But the others are split somewhat equally. The two-step version 2 on the far right had 1 don't know and 4 refusals. But if you add also in the don't knows from that extra part that we added, so there's the don't know that they can just volunteer and that gets coded, and then there's the don't know for that version. Do you not know what this question means? That's where you get up to the 1.7%. 7 people took that option out of 12 total. So if we had
that phrase out in the one that you're implementing,
that's right.
So this is going to go down.
The one with the extra phrase is the 1.7%, and the one without the extra phrase is the 0.7%. So that's we'll probably still get that 0.7 or somewhere around there.
So I was just struck by, I know that you selected it because of the shorter duration.
Yeah.
So you decided that the shorter duration is better even though your non-response is higher.
Even though the response is a little bit higher, when you think about overall respondent burden and survey burden, you know, how much time, how many seconds are you adding to this interview that can be long for some people already, that seemed like the better choice. Yeah, so this was a small pilot, and these are small rates. You know, it's hard to know if they'll stand up in the full version. I haven't had a chance to look at that yet. Good question, though. Yeah.
Okay,
Yeah.
one from online. Any questions on SES of this population?
I don't have any statistics from what we. Oh, questions. The question is about any information on the SES, the socioeconomic status of the population. I don't have any information on that from our data. If anybody online knows of that literature, I'd encourage you to put it up there. And probably some of the citations that I put at the beginning that talk about transgender health will have some of that in there, but nothing from CHIS. Yeah.
So the options that you really give them now for their current gender are still male, female, or transgender. How about people who are gender fluid or they don't
Yeah.
non-cis?
Yeah. So it's actually, we don't ask specifically, are they transgender? Yep. Sorry. I have to remember to ask or restate. I also want to find the wording. Here we go. So the question was, what are the options that we asked, and what do we do with people who are cisgender or have, you know, gender fluid or have, you know, some other, you know, gender queer, some other terminology that they use. So we don't actually ask, are you transgender? We're doing the two-step version 1. So we say, what sex were you assigned at birth on your original birth certificate? Well, I guess as a follow-up, they can say transgender. They can also just say male or female. What the follow-up being, do you currently describe yourself as male, female, or transgender? And then if they say something else, if they say genderqueer, gender fluid, we record that. So actually I think I brought some of the phrases that we saw in the 2015 data just because it was interesting. Yeah, so we don't actually lose any data. We still, even though it's not presented to them, if they say it out loud, it gets recorded by the interviewer. So we saw we saw the phrases demigender, both male and female, things like that. You know, and demigender was a new one for me. I've never heard that one.
So we've got a couple questions that are sort of similar, so I'm going to try and combine them. One is, what about capturing people who do not identify as man or woman currently, i.e. non-binary? What if a respondent wants to select 2 for current gender, male and trans, or female and trans, or even male and female?
Mm-hmm. Yeah, that would probably come out in the question being, sorry, the question being, what if, following up on the last one pretty well actually, what happens for people who want to say 2 genders or male and trans or something like that? Those will be captured in the other specified. So if they don't say I'm male and female transgender and they say, well, I'm something else, then we record that. Yeah.
In Europe, there is small evidence that in the last 2 years or so, for surveys or items in surveys that are considered much more personally sensitive, people are more and more reluctant to answer because of concerns about security of those personal data. I'm curious what explanation you give at the beginning of the survey that may answer those concerns. And I'm also quite interested in your own thoughts about it takes some kind of technical knowledge to judge whether your explanation about the security will, is valid and is okay.
Mm-hmm.
So that there's a tricky bit there. So the crafting of that, presenting it, is really interesting.
Yeah.
But my main question would be, it may be that further on into the questionnaire, that when you start asking questions like this, people forget or suddenly get very concerned about that, and whereas it's a general thing you're saying at the beginning. What's your take on this whole issue, and what about concerns that de-identified data might then be re-identified in certain?
Yeah, so a lot of good questions there having to do with the privacy of the data, the actual privacy, and the perceived privacy by respondents. We obviously here at CHIS have a lot of data security facets of how we handle our data to deal with the actual privacy. But the perceived privacy is really important. So when respondents are recruited on the phone in the first place, they're read a confidentiality statement by the interviewer that talks about how their data are protected, that it is protected, things like that. And you mentioned some European surveys. I know in the U.S., some surveys have taken the most sensitive questions in a survey and put them in an instrument that's read by a computer, or not read like with the computer voice, but with a human voice that's not live. So for anything where the respondent might not want to answer honestly to a human because they're embarrassed or it's just private, they would be asked by a voice that's read to them that's not human. That's a recorded voice of an interviewer, essentially, to transfer it over to answer those questions. So that's one way that other surveys deal with it. We just have live interviewers doing the interviews. We haven't done that more technical part. Yeah, I know that.
Has there been any research?
There's some research on it, yeah. So, I mean, you have to, for ethical reasons as well as just, getting better response rates, you have to tell respondents that their data are private, how it's private, who they can call if they have any concerns. Sometimes they'll call us, they'll call the IRB if they do have concerns.
Well, my immediate response to that is that's what they all say.
Right, and then, yeah, we do worry about that. So when, speaking outside of what we're talking about here for the gender identity test, we craft these phrases in a way that everybody can understand, that aren't so technical that it raises flags that it shouldn't raise, but you can never get the people that are so skeptical. I mean, that's why we are challenged with getting people to respond to surveys. That's part of the problem. Yeah.
Okay, we have time for maybe 2 more questions, but again, if you didn't get your question answered, please feel free to email me, gdriscoll@ucla.edu, or Matt directly, and we will get to them. We're getting down into the nitty-gritty, Matt, but here's a question about can someone comment on using the terms male, female, which are usually associated with sex, versus man, woman, more commonly associated with gender?
I like that. So
the second question about gender in the two-step method, was this an intentional decision?
Okay. I'll do the first one. I might have to ask you for the second one again. The first one was, so for our follow-up question, do you currently identify as, do you currently describe yourself as, why not say man or woman? Because that's a gender question. I think that's a pretty good point. I don't know if anybody's tested that. It might be neat to try. I could see just sort of off the cuff, if you've physically transitioned so that you've gone through sex realignment surgery, so you're also anatomically male or female. Now it gets back to male or female, but yeah, that's a neat point. And what was the second one, Gwen?
Was this an intentional decision? Well, he just said he didn't.
Yeah.
The second question about gender in the two-step method. I think that was the question.
For some of the more detail about these two, that Williams Institute Genius report that's quoted a few times in the talk is a great place to look, and they'll go through some of the side issues about why this wording and not that wording, because that report draws from a lot of pre-testing that was done by other sources too.
Okay. Is there another question, Lauren?
So in your slide you mentioned that the Spanish version takes longer time?
Yeah.
Is it because the question is longer, or will take the respondents longer time to respond?
I think it's probably a little bit of both. So the question was, I told you that the Spanish version took a little bit longer, and is that because the questions are longer to read, or the respondents are taking longer to answer? I don't speak Spanish myself, so I have to rely on what my Spanish-speaking colleagues tell me. But the questions are a little bit longer just verbally, and I see some people nodding in the room. That's good. I'm remembering the right thing in Spanish, so it's just more words to say it. Another neat study would be to split those out, so you could see if there's something else going on that might be more cultural and is taking people longer to respond. Yeah, interesting. Okay. Other questions?
That's it. Thank you so much, Matt.
Great.
And please come back on the 29th of February.
Thanks, everybody.